You know, when we think about fighting cancer, our minds, they just naturally jump to things like powerful drugs and high-tech radiation, right? And don't get me wrong, those are absolutely critical. But what if one of the most powerful weapons in this fight has been hiding in plain sight this whole time?
And that really brings us to the big question for today. With all of our incredible medical advances, are we accidentally leaving some really powerful scientifically backed tools on the table? Tools that could totally change the game for patients.
So here's what we're going to cover. We'll start with this overlooked weapon, then dive into the absolutely stunning results from something called the challenge trial. From there, we'll see how this is about way more than just exercise and ask the big question, why isn't this stuff standard practice? And finally, we'll look at what your full cancer toolbox could look like.
All right, let's jump right in. What exactly is the missing piece in the typical conversation we have about cancer?
Look, modern medicine gives us the heavy hitters, the absolute cornerstones of cancer care: surgery, chemo, radiation. But that's not where the story has to end. The scientific evidence is just piling up for other things, simpler, safer things that can make a huge difference in a patient's journey. But for some reason, they just don't get the same spotlight.
And that brings us right to the heart of it all, a truly groundbreaking study that put one of these overlooked tools to the ultimate test. Let's talk about the challenge trial.
Okay, so the setup was actually pretty simple. Researchers got together almost 900 patients who'd already finished their main treatment for high-risk colon cancer. They split them into two groups. One group got the usual health pamphlets and information, but the other group, they got a professionally guided, moderate exercise program. We're talking just 2.5 hours a week. The question was, could something so basic, so fundamental as just moving your body actually change their odds?
Well, the results were, wow, just staggering. First off, the patients who exercised had a 28% lower risk of their cancer coming back. I mean, just stop and think about that number for a second. That is a massive, massive difference.
And it gets even better. Those same patients, the ones in the exercise group, also had a 37% lower risk of dying from any cause. So we're not just talking about keeping cancer at bay, we're talking about living longer, period. So what does that look like long term? Well, 8 years down the road, 90% of the patients who exercised were still alive. For the group that didn't, that number was 83%. That is a seriously powerful gap, and it came from a really simple structured plan.
And let's look at it another way. At the 5-year mark, when you look at who was disease-free, meaning the cancer hadn't come back, the exercise group was at 80%. That's a full 6 points higher than the control group. In the world of cancer research, that is a home run.
If you're still not convinced, listen to what one of the lead investigators, Dr. Christopher Booth, had to say about it. He said that if a brand new chemo drug came out with these kinds of numbers, a 28% reduction, it would be considered practice-changing. But this wasn't a drug, it was just exercise.
Okay, so the results for exercise are just incredible, right? But what the challenge trial really does is it cracks open the door to a much bigger idea. It suggests that exercise is just one tool in a much, much bigger collection of strategies.
So I want you to think about it like this. Cancer care isn't just a single hammer. It should be a full toolbox. The challenge trial proved, without a doubt, that exercise is one of the most powerful tools in there. But it's just one of many that patients can use to take back some control and improve their outcomes.
So what else is in this toolbox? Well, alongside exercise, you've got solid science backing up things like evidence-based nutrition, getting your sleep dialed in, and managing stress. It also includes things you might not think about, like fostering social connections, proper hydration, and targeted nutrient support. And there's even this fascinating growing field of repurposed medications. You know, common drugs for other things, like metformin for diabetes, that are now showing some really promising anti-cancer effects in studies.
This all sounds pretty amazing, doesn't it? It's effective, it's low cost, it's accessible to almost everyone. Which, of course, leads to the million-dollar question, if all these tools are so powerful, why on earth aren't they a standard part of every single cancer patient's treatment plan?
Well, the source material suggests it kind of comes down to a systemic bias. Your standard therapies, which are absolutely vital, are also part of a system that's high profit and heavily marketed. These lifestyle tools, on the other hand, there's little or no profit in telling someone to exercise or manage stress. They're totally evidence-based, but they depend on the patient taking action, not just taking a pill. So they often get sidelined in the main conversation.
And yet the experts couldn't be clearer. Dr. Carrie Cornea, who is a giant in this field of research, says that based on the evidence we have,
Exercise isn't just some nice-to-have thing to make you feel a bit better. No, it should be considered a core part of the standard of care for survival. And that brings us to the final, and honestly the most important part of all this. How can you actually use this information? How do you open up that full cancer toolbox for yourself or a loved one? The key idea here is something called an integrative approach. Now, let's be crystal clear about what this means. This is not about replacing your medical treatment. Not at all. It's about enhancing it. It's a strategy that puts you, the patient, at the center, using all these proven lifestyle tools to make the standard treatments work even better and to build up your body's own resilience.
So here's the game plan, the big takeaway. Step 1, and this is non-negotiable, is you follow the plan from your medical team, your doctors, your oncologist. Step 2 is you actively start to weave in these proven lifestyle tools, the exercise, the nutrition, the stress management, right alongside that medical plan. And the goal of all this? To build up your resilience, to help you tolerate treatment better, and ultimately, to stack the odds in your favor for the best possible outcome.
So I want to leave you with this final thought. A 28% lower risk of cancer coming back. A 37% lower risk of death. Seriously, if a drug company announced a new pill that could do all that, it would be $1 billion blockbuster. It would be on the front page of every newspaper in the world. The evidence is showing us that we may already have that power, and it doesn't come in a pill at all.